I'm Maisha Robinson, Assistant Professor of Neurology at Mayo Clinic in Florida. I'm also the Medical Director of Palliative Medicine, and the article Palliative Care in Neurology will appear in the Mayo Clinic Proceedings. So palliative care in neurology really focuses on the need and the benefit of incorporating palliative care into the management plans for patients with neurologic disease. We have an opportunity to not only provide care to our patients, but also to their families as we collaborate with neurologists and non-neurologists caring for patients with neurologic disease. We outline a number of neurologic conditions. We detail some of the data specific to those conditions with regard to management of some symptoms, as well as discussing advanced care planning and the need for early conversations about goals of care. Patients with neurologic disease have a number of symptoms that the literature suggests are undertreated and undermanaged, at times also underdocumented. In medical training, we often are not taught about some of these symptoms and when we need to assess them and how we can address them. And so palliative care offers us an opportunity to really focus on trying to improve quality of life for our patients with neurologic disease. Palliative care is really an approach to care. All neurologists, all physicians really are already engaging in some degree of palliative medicine. Some of our patients with neurologic disease would benefit from subspecialty palliative care as well. Palliative care is one of the fastest growing trends in healthcare. And this is likely because both patients, family members, and other clinicians recognize that there's a significant benefit to incorporating not only primary palliative care, but subspecialty palliative care into the management plan for those patients. Palliative care aims to recognize, prevent, and alleviate suffering of all forms: physical, psychological, spiritual, and social suffering. And it's appropriate for patients with advanced or chronic medical conditions at any age and at any stage of the condition. Neuropalliative care, or palliative care specifically for patients with neurologic disease, is in a burgeoning field in neurology. There are many opportunities for research, including what is the best way to deliver palliative care to patients with neurologic disease. There are other thoughts about telepalliative care or home-based palliative care, or incorporating subspecialty palliative care routinely into the management plans for these patients. There are a number of aspects of palliative care in neurology that we don't yet understand, but there are a number of people, specifically neurologists, who are dedicating their careers to practicing neuropalliative care, who are looking for the best manner in which to deliver this. The takeaway message of this article is really that patients with neurologic disease have myriad symptoms which could benefit from a palliative approach to care. It's important to know that all palliative care is not hospice care. Rather, hospice care fits under palliative care, but it's specifically for people that have 6 months or less to live if the disease progresses in its normal fashion. Given that, almost all the patients with a chronic progressive neurologic disease could benefit from primary palliative care, which is palliative care provided by their primary neurologist or their primary care physician. And some of those patients who have complex medical needs or complex psychological issues or complex spiritual issues can benefit from subspecialty palliative care.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.